So, if you are considering one of these cutting-edge vaginal laser or radiofrequency therapies, you might naturally assume something. You might assume that the intense, thermal heat of these devices would just kind of vaporize any microscopic threat in its path.
Right. I mean, it sounds like a reasonable assumption.
Exactly. But if you walk into a clinic with a really common bacterial imbalance like bacterial vaginosis, you will absolutely not get treated. I mean, you will be sent straight home.
Yeah, they won't even touch the device.
Right. So today on the deep dive, we are unpacking this really bizarre medical paradox. We're looking at what happens when highly sophisticated tissue remodeling machines basically collide with one of the most stubborn bacterial fortresses on the planet.
It really is a fortress.
And the central question we're exploring for you today is this. Can active bacterial vaginosis affect your ability to receive vaginal energy treatments? And the short answer is yes, it absolutely halts it.
It's a hard stop.
But, and here's the massive twist, those exact same lasers are quietly emerging as a secret weapon against the infection itself.
Yeah, it's honestly one of the most fascinating contradictions currently being debated in women's health right now.
It's wild. And just to set the stage for you, we are pulling from a pretty dense stack of source material today.
Very dense. We've got clinical guidelines from NICE-H and the World Health Organization, plus some really key randomized controlled trials like the Athanasius study.
Right.
And we're also looking at historical FDA safety communications and some groundbreaking cellular research on thermal neurogenesis, which we'll get to later.
Yeah, that neurogenesis stuff is mind-blowing.
Right.
But, okay, to make sense of how an energy device can be totally contraindicated for an infection, yet potentially cure it, we have to kind of unpack the underlying mechanisms, right?
Exactly. We have to look at the bacteria and the technology.
So let's start with the condition itself, bacterial vaginosis, or BV. It is so heavily misunderstood.
Oh, incredibly misunderstood. I mean, first of all, it is not a sexually transmitted infection. You don't, catch it in the traditional sense.
Right. It's not an outside invader necessarily.
Yeah, exactly. It's a fundamental disruption of your body's ecosystem. So in a totally healthy state, the vaginal microbiome is dominated by lactobacillus.
The good guys.
The good guys, yeah. These bacteria act as the primary defense force. They are constantly producing lactic acid to keep the vaginal pH acidic, usually between 3.8 and 4.5.
And that acidity is basically highly hostile to outside pathogens.
Right. But when that lactobacillus population crashes for whatever reason, the pH rises.
Yeah.
And that creates this alkaline environment where a really diverse mix of anaerobic bacteria, most notoriously Gardnerella species, can just aggressively overgrow.
And Gardnerella does not just multiply and, float aimlessly around.
No, not at all. This is the insidious part. It engineers a highly sophisticated defense mechanism. These bacteria adhere really strictly to the vaginal wall and construct a dense biofilm matrix.
A biofilm, so basically like a microscopic bunker made of biological mortar.
That is the perfect way to describe it, a bunker. Because floating bacteria, they're easy targets for oral or topical treatments.
Yeah.
But once they anchor to the tissue and pour this protective slime over themselves, standard antibiotics literally just bounce right off the roof of the bunker.
Wow.
Yeah, I mean, the drugs might wipe out the free-floating bacteria, which gives you, temporary symptom relief, but they completely fail to penetrate the core colony underneath.
Which perfectly explains that just maddening cycle of recurrence so many patients go through.
Oh, absolutely.
Like, you take a course of metronidazole or clindamycin, your symptoms clear up for a week, and then boom, the infection comes roaring back.
Yeah, it's devastating. And the sources we are looking at note a staggering 80% recurrence rate within 3 to 12 months after standard antibiotic therapy.
80%. That is wild.
It is. The biofilm essentially just waits out the pharmaceutical assault. And the second the antibiotics are out of your system, the bacteria repopulate the environment.
Okay, so that resilient biofilm is precisely what makes BV such a clinical nightmare. So if pharmaceuticals are just bouncing off this biological bunker, you would naturally think, okay, modern medicine needs to bring out the heavy artillery.
Right, bring in the big guns.
Which brings us to the energy-based devices. And the terminology here is, well, it sounds like something out of a science fiction novel.
It really does. We're talking about fractional microablative CO2 lasers, ERYAG lasers, and non-ablative radiofrequency, or RF devices.
But the underlying mechanism across all of these, it really just relies on one primary trigger, right? Controlled thermal stimulation.
Exactly. Heat. These machines are engineered to deliver heat deep within the vaginal tissue. Specifically, they're targeting a thermal threshold between 40 and 45 degrees Celsius.
And we should clarify this is entirely non-surgical.
Yes, completely non-surgical. A fractional CO2 laser achieves this by punching thousands of microscopic, evenly spaced holes right into the mucosal tissue.
Which is called microablation.
Right. And radiofrequency devices take a totally different approach. They use high-frequency electromagnetic currents to generate heat through tissue resistance.
So they warm the deeper layers without actually breaking the surface skin at all.
Exactly. But both modalities, whether it's laser or RF, they are ultimately trying to trigger the exact same biological response.
Which is a localized healing cascade.
Precisely. When tissue is heated to that really specific 40 to 45 degree window, it stimulates fibroblasts.
And those are like the biological factories, right?
Yeah, they're responsible for neocollagenesis, which is the production of new collagen, and neoelastogenesis, the creation of new elastin fibers.
Wow.
Plus, that thermal stress prompts the formation of new microscopic blood vessels, which increases local circulation.
So you are effectively remodeling the vaginal mucosa from the inside out.
Okay.
Making the tissue thicker, more elastic, better hydrated.
Exactly.
Okay, let's unpack this with an analogy. So we have this delicate internal ecosystem. Think of it like a garden.
I like that, a garden.
And BV is what happens when aggressive bunker-building weeds take over the terrain. And these high-tech lasers and RF devices, they act as highly controlled aerators and soil warmers, designed to rejuvenate the biological ground itself.
That's a great way to visualize it.
But this brings us to the core conflict of our deep dive. If these machines are designed to heat and remodel the soil, so to speak, what actually happens when you apply that intense thermal energy to an environment currently overrun by a Gardnerella biofilm?
The procedure comes to a complete hard halt.
Really? Just stop.
Just stops. Active bacterial vaginosis, or frankly any active genital infection, is a strict, non-negotiable contraindication for energy-based treatments.
So they won't even try?
No. The exclusion criteria across, multiple clinical trials, the NICE guidelines, standardized clinic protocols, they are entirely unified on this front. If a patient presents with active BV, the clinician must refuse the treatment.
But wait, my immediate instinct here, and frankly what I thought when I first started reviewing these sources, is to totally question that logic. Well, if a CO2 laser is literally vaporizing microscopic columns of tissue, or an RF wand is heating the mucosal wall to 45 degrees, why wouldn't that thermal energy just incinerate the Gardnerella bacteria?
That's a super common assumption.
Right. I mean, it seems like the perfect opportunity to just blast the infection away while you're already in the chair.
I get that, but it really comes down to the fundamental physics of bacterial heat tolerance versus human cellular heat response.
Okay, tell me more.
So human tissue begins to undergo optimal collagen remodeling at around that 40 to 45 degrees Celsius mark. That is the carefully calibrated target zone for these medical devices.
Right, the sweet spot for the fibroblasts.
Exactly. But to actually sterilize a bacterial colony, especially one that is encased in a robust biofilm, you would need sustained temperatures well over boiling.
Oh, wow.
Yeah, I mean, you would need literal autoclave levels of heat to denature their proteins. At 45 degrees, you are not incinerating the Gardnerella, you are barely making them sweat.
Oh my gosh.
The lasers are calibrated entirely for tissue stimulation, not for sterilization.
Which means, and correct me if I'm wrong, using a microablative laser on an active infection is essentially a recipe for an inflammatory disaster.
It's a massive disaster because if you use a CO2 laser to punch thousands of microscopic wounds into tissue that is already swimming in a pathogenic overgrowth.
You are intentionally opening the gates of the city to an invading army.
That is exactly what you're doing. You are giving the Gardnerella direct, unimpeded access to the deeper, highly vulnerable submucosal layers.
And the clinical consequences of doing that have to be severe.
Oh, they are. It risks driving a localized surface imbalance into a deep tissue infection. The immune response to that would trigger massive inflammation.
Which completely compromises the tissue's ability to even heal in the first place.
Right. Your body cannot focus on generating healthy new collagen if it is suddenly forced to fight a raging, artificially induced bacterial invasion.
Makes total sense. So the active BV absolutely must be treated first. The baseline environment needs to be cleared with standard therapies, like a course of antibiotics or lactic acid gels, just to ensure the tissue is secure before you introduce any thermal stress.
Exactly. You have to put out the fire before you remodel the house.
Okay, but here's where it gets really interesting. As we dug deeper into the clinical data, The narrative takes a massive pivot.
It really does. It's a staggering paradox.
Right, because we just established that an active current BV flare-up will definitively cancel your laser appointment. However, the medical community is now looking at those exact same lasers as a novel, cutting-edge treatment for recurrent, stubborn BV.
Which sounds completely counterintuitive at
Oh,
first.
totally. But if a patient cannot seem to break the cycle of infection, specialized clinics are utilizing energy devices not to kill the bacteria directly, but to fundamentally alter the environment they rely on to survive.
It is an incredibly elegant approach, honestly, to a problem that has baffled gynecologists for decades. Because if you cannot penetrate the weeds with chemicals, you change the composition of the soil so the weeds can no longer take root.
And the sources point to the Athanasius study, which provides a really fascinating look at how this plays out in actual practice.
Yes, the Athanasius study is key here. Researchers took 53 postmenopausal women who were suffering from recurrent imbalances, and they treated them with a microablative fractional CO2 laser.
And the results after just 3 sessions were basically a complete paradigm shift. Let's look at the data points because they're so compelling.
Yeah, like a...
Before the laser treatment, lactobacillus, that crucial shield-building bacteria we talked about earlier, it made up only 30% of the vaginal flora in these patients.
Which is far too low.
Right. But after the laser therapy, that population surged to 79%.
It more than doubled.
And concurrently, the overall vaginal pH dropped from a really hostile alkaline 5.5 down to a healthy acidic 4.7. And the pathogen load, specifically the Gardnerella, plummeted from 6% down to just 2%.
It's incredible data.
But I have to ask, if the laser's not killing the bacteria with heat, how is this actually working?
Mhm.
The biological mechanics of restoring that microbiome must be brilliant.
Oh, they are. So the laser achieves this by initiating a complete remodeling of the squamous stratified epithelium.
Which is the multi-layered mucosal wall of the vagina.
Exactly. And whether it's due to aging or drops in estrogen or chronic inflammation from recurrent infections, that epithelial wall can become really thin and fragile.
Okay.
The thermal injury from the laser forces the host body to rebuild a thick, robust, highly structured mucosal barrier. And the reason this specifically targets bacterial vaginosis comes down to cellular nutrition.
Right, because mature, healthy squamous cells in the vaginal wall contain abundant levels of glycogen,
Exactly. Glycogen.
which is essentially a stored form of cellular sugar.
Yeah.
And as these newly built thick layers of healthy cells naturally mature and shed off into the vaginal canal, they release that glycogen into the environment.
And guess what thrives on glycogen?
Lactobacillus.
Yes. It is their primary food source. So the laser therapy is essentially forcing the host body to replenish the food supply for its own defensive army.
That is so cool.
As the lactobacillus feast on this newly available glycogen, they rapidly multiply. And a natural byproduct of their digestion is the excretion of lactic acid.
Oh, I see where this is going.
Right. That flood of lactic acid lowers the pH of the entire vaginal vault, restoring the acidic environment that Gardnerella simply cannot tolerate.
So the treatment doesn't fight the infection with an external medicine at all? It just restores the structural integrity of the tissue so your body's natural microbiome can outcompete the biofilm and push the infection out itself.
That's exactly it. And we are seeing this physiological logic adopted in highly specialized clinical practices today.
Yeah, the sources highlight protocols from institutions like InSync Medical, which now offer vaginal laser therapy as an adjunctive option for what they classify as recalcitrant cases.
Right, they're really stubborn ones.
Exactly. Patients who've been trapped in a relentless cycle of recurrent BV for over 12 months, cases where standard biofilm disruptors, suppressive gels, and aggressive antibiotics have comprehensively failed to break the loop.
The laser becomes a tool to reset the biological baseline.
So hearing about these clinical successes, it can easily lead to a sense of unbridled optimism. I mean, if you were listening to this and suffering from chronic BV, you might assume you should immediately go out and find a laser clinic.
I would urge caution there. We really have to ground this physiological potential in strict regulatory and safety realities.
Let's talk about that.
The transition from tightly controlled specialized clinical trials to the broader commercial medical market, it is fraught with complications. Which brings us to the historical context of the July 2018 FDA safety communication.
Oh, that communication was a seismic event in the gynecological world.
It really shook things up.
The FDA issued a really stark, explicit warning. They stated that the safety and effectiveness of energy-based devices for vaginal rejuvenation or for treating menopause-related symptoms and sexual function had not been established.
And they outlined severe, life-altering reported risks. We're talking about severe vaginal burns, deep tissue scarring, dyspareunia,
Which is painful intercourse.
right, and chronic, long-lasting pelvic pain. Plus, the Royal College of Obstetricians and Gynecologists in the UK issued parallel statements advising extreme caution.
They heavily emphasized that these lasers were not recognized standard treatments for functional medical conditions.
Exactly. And to understand the severity of those warnings, you really have to look at the landscape of cosmetic gynecology leading up to 2018.
It was basically the Wild West out there, wasn't it?
It truly was the Wild West. You had commercial clinics and med spas aggressively marketing these highly powerful medical lasers as quick-fix rejuvenation treatments.
And they were frequently operated by undertrained staff rather than specialized physicians.
That was the biggest issue. When a clinician uses a fractional CO2 laser or an RF device that is not meticulously calibrated for a patient's specific tissue thickness and medical history.
The thermal energy goes from being a precise stimulant to a destructive force.
Exactly. That is how you get catastrophic burns and permanent scarring.
So what does this all mean? The contrast between the FDA's dire warnings and the overwhelming success of the Athanasius study, it really highlights the crucial difference between the tool itself and the hands operating it.
100%. In rigorous clinical trials, these devices are operated by highly specialized physicians who are adhering to strict multi-step protocols.
And the patients are heavily screened.
Heavily screened. And under those controlled conditions, the adverse events reported are generally mild and transient.
Yeah.
Typically limited to, a few days of minor spotting or mild tissue itching.
It is entirely about clinical context.
Exactly. Which is why medical guidelines universally dictate that energy-based devices are explicitly not a first-line treatment for any vaginal condition, especially bacterial vaginosis.
So if a patient presents with BV, they are never just handed a laser as a starting point.
Never. Standard medical guidelines require a really systematic escalation of care.
You start with the least invasive, most proven interventions. The medical playbook requires initiating lifestyle modifications first, right?
Yes, like eliminating douching or stopping the use of alkaline scented soaps that disrupt the natural pH.
And from there, you move to standard pharmaceutical interventions, utilizing oral or topical antibiotics like metronidazole or clindamycin to attempt to clear that biofilm.
And honestly, even if the BV comes back after that first round, the escalation does not immediately jump to laser therapy.
No, the guidelines from the DGGG, which is the combined German, Austrian, and Swiss societies for gynecology, they recommend exhausting long-term suppressive therapies first.
Right. A standard suppressive protocol might involve applying a metronidazole gel twice a week for 16 continuous weeks.
16 weeks?
Yeah, it's a long process, often followed by targeted vaginal probiotics to try and aggressively outcompete the Gardnerella biofilm over a prolonged period.
So energy devices remain a strict, last resort adjunctive therapy. They require an incredibly thorough clinical assessment to ensure the patient's mucosal tissue can actually handle the thermal stress without scarring.
Yes, and if a clinic offers a laser treatment for recurrent BV, they are required by good medical practice standards to provide full documented transparency.
Meaning, the patient must be explicitly informed that this is considered an off-label or experimental use of the device.
Exactly. And they must be briefed on the exact thermal risks pertaining to their specific biology.
The intersection of these technologies and this specific bacterial imbalance is just a perfect testament to the complexity of human biology.
It really is. Bacterial vaginosis is far more than a simple infection. It is a profound structural disruption of a very delicate ecosystem.
Right. So to summarize for you listening, if you have an active BV flare-up, applying laser or radiofrequency heat is a hard, non-negotiable danger. You absolutely cannot risk driving a surface pathogen deeper into microablated tissue.
No, you'll make it much worse.
But, however, for those suffering from the nightmare of recurrent BV, that exact same thermal technology offers a way to bypass the failing antibiotics. By physically remodeling the vaginal wall and restoring the natural glycogen food supply, the laser empowers your body to repopulate its own protective lactobacillus.
It's giving your body the tools to fix itself.
Yeah, we spent this deep dive analyzing how controlled heat builds collagen and feeds bacteria, but there is one final, almost futuristic detail buried in the cellular research that pushes the potential of these devices into entirely new territory.
Yes, the Kudo study. We have to talk about the Kudo study.
It analyzed the cellular response to temperature-controlled radiofrequency devices,
Mm.
and the data suggests the biological reaction goes far beyond just connective tissue and glycogen production.
The Kudo study is truly at the frontier of energy-based medicine right now. It presents emerging evidence that the repeated, highly controlled heat stimulation from RF devices may actually induce a phenomenon known as thermal neurogenesis.
Thermal neurogenesis.
Right. The heat appears to activate specific biological pathways, likely involving heat shock proteins, that trigger the release of nerve growth factors.
So this stimulation doesn't just repair tissue.
No. It promotes neurite outgrowth, which is the physical rewiring and growth of completely new nerve pathways within the mucosal and submucosal layers.
That is staggering. I mean, the implications of thermal neurogenesis were just massive.
Yeah.
Right now, the medical community is fiercely debating the use of these machines to fight stubborn bacterial biofilms and thicken fragile mucosal walls. But if controlled thermal energy can be used to literally prompt the body to grow new nerves,
The future applications could completely revolutionize gynecology.
we are talking about the potential to cure chronic, unexplained pelvic pain conditions. We could eventually use these specific RF frequencies to repair damaged neural networks resulting from traumatic childbirth or complex pelvic surgeries or long-term neuropathy.
It suggests the current debate over vaginal lasers is only scratching the surface of what energy-based medicine is capable of achieving.
It's a whole new paradigm.
It is. We are observing a transition from modalities that simply destroy or ablate tissue to technologies that remodel environments, and finally to devices that might fundamentally regenerate the nervous system itself.
Hmm.
The mechanism of action is scaling from the microscopic bacterial level all the way up to the systemic neural network.
It is an incredible frontier to watch unfold. But for now, if you are navigating your own diagnostic landscape with recurrent infections or considering these treatments, just remember that the goal of the most high-tech machine in the room isn't always to aggressively blast a problem away.
No, usually it's more subtle than that.
Right. Sometimes the most powerful medical interventions are simply designed to till the biological soil, rebuild the structural foundation, and give your body's own brilliant ecosystem the leverage it needs to do the heavy lifting itself.